Abu al-Qasim al-Zahrawi 936-1013 CE. Abul Qasim Caliph ibn al-Abbas al-Zahrawi, known in the West as Abul Qasim's father of surgery, was born in 936 CE in Zahra in the neighborhood of Cordova. He became one of the most renowned surgeons of the Muslim era and was physician to King al-Hakam II of Spain. After a long medical career, rich with significant original contribution, he died in 1013 CE. Almost 1,000 years ago, at a time when Spain, Andalusia, was part of the Islamic Empire, there lived near the capital city of Córdoba one of the great, but now largely forgotten, pioneers of surgery. He was known as al-Zahrawi, though in European languages his name is written in over a dozen different ways: Abulcasis, Albacasis, Bulcasis, Bulqasim, Bulkari, al-Zahawi, Ezrawi, Zahravius, al-Qurani, al-Sarani, Ayakaravi, al-Karavius, al-Sarawi, etc. Al-Zahrawi is believed to have been born in the city of El-Zahra, 6 miles northwest of Córdoba, sometime between 936 and 940. It was here that he lived, studied, taught and practiced medicine and surgery until shortly before his death in about 1013, 2 years after the sacking of El-Zahra. Because El-Zahra was pillaged and destroyed, little is known about its illustrious son El-Zahrawi. He was first mentioned by the Andalusian scholar Abu Muhammad bin Hazm, 993-1064, who listed him among the great physician-surgeons of Moorish Spain. The first known biography of El-Zahrawi, however, appeared in al-Humaydi's Jadwat al-Muktabis, an Andalusian savant, completed 6 decades after El-Zahrawi's death. It is clear from El-Zahrawi's life history and from his writings that he devoted his entire life and genius to the advancement of medicine as a whole and surgery in particular. El-Zahrawi wrote a medical encyclopedia spanning 30 volumes which included sections on surgery, medicine, orthopedics, ophthalmology, pharmacology, nutrition, etc. This book was known as at-Tashrif and contained data that El-Zahrawi had accumulated during a career that spanned almost 50 years of training, teaching and practice. He apparently traveled very little but had wide experience in treating accident victims and war casualties. In at-Tashrif, El-Zahrawi expressed his concern about the welfare of his students whom he called "my children." He emphasized the importance of a good doctor-patient relationship and took great care to ensure the safety of his patients and win their trust irrespective of their social status. El-Zahrawi's clinical methods showed extreme foresight. He promoted the close observation of individual cases in order to establish the most accurate diagnosis and the best possible treatment. He insisted on compliance with ethical norms and warned against dubious practices adopted by some physicians for purposes of material gain. He also cautioned against quacks who claimed surgical skills they did not possess. At-Tashrif contains many original observations of historical interest. In it, El-Zahrawi elaborates on the causes and symptoms of disease and theorizes on the upbringing of children and youth and on the care of the aged and convalescent. In the section on pharmacology and therapeutics, he covers areas such as cardiac drugs, emetics, laxatives, cosmetology, dietetics, materia medica, weights and measures and drug substitution. At-Tashrif was translated into Latin by Gerard of Cremona in the 12th century and alongside Avicenna's canon, played a major role as a medical text in the universities of Europe from the 12th to the 17th century AD. 2 of El-Zahrawi's treatises deserve special mention. Firstly, his 28th treatise, known in Latin as Liber Servatoris de Preparatione Medicinarum Simplicium, tablet making, filtering of extracts and related pharmaceutical techniques. This treatise was printed in Venice in 1471 by Nicolaus Jensen. Perhaps the most important treatise is the one on surgery. This monumental work was the first in Arabic to treat surgery independently and in detail. It included many pictures of surgical instruments, most invented by al-Zahrawi himself, and explanations of their use. Al-Zahrawi was the first medical author to provide illustrations of instruments used in surgery. There are approximately 200 such drawings ranging from a tongue depressor and a tooth extractor to a catheter and an elaborate obstetric device. The variety of operations covered is amazing. In this treatise al-Zahrawi discussed cauterization, bloodletting, midwifery and obstetrics and the treatment of wounds. He described the exposure and division of the temporal artery to relieve certain types of headaches, diversion of urine into the rectum, reduction mammoplasty for excessively large breasts and the extraction of cataracts. He wrote extensively about injuries to bones and joints, even mentioning fractures of the nasal bones and of the vertebrae. In fact, Kocher's method for reducing a dislocated shoulder was described in at-Tashrif long before Kocher was born. Al-Zahrawi outlined the use of caustics in surgery, fully described tonsillectomy, tracheotomy and craniotomy operations he had performed on a dead fetus. He explained how to use a hook to extract a polyp from the nose, how to use a bulb syringe he had invented for giving enemas to children and how to use a metallic bladder syringe and speculum to extract bladder stones. Al-Zahrawi was the first to describe the so-called Wölcher position in obstetrics, the first to depict dental arches, tongue depressors and lead catheters and the first to describe clearly the hereditary circumstances surrounding hemophilia. He also described ligaturing of blood vessels long before Amboise Père. Once at-Tashrif was translated into Latin in the 12th century, al-Zahrawi had a tremendous influence on surgery in the West. The French surgeon Guy de Chauliac in his Great Surgery, completed in about 1363, quoted at-Tashrif over 200 times. Al-Zahrawi was described by Pietro Argolata, died 1423, as without doubt the chief of all surgeons. Jacques Delechamps, 1513–1588, another French surgeon, made extensive use of at-Tashrif in his elaborate commentary, confirming the great prestige of al-Zahrawi throughout the Middle Ages and up to the Renaissance.